A rural area is where I've always wanted to work. That was my dream. I wanted to be somewhere where I was needed and somewhere where I could make a difference.
Beautiful. Absolutely perfect. You are doing such an awesome job growing this little man.
There's no OB care out here. And for these ladies to get care, they would have to drive over an hour if I were not out here. And some of them just don't have the transportation to do that, the money to do that.
Maternity care is disappearing in much of rural America. This small hospital in Louisville, Georgia, is one of the few facilities within a 60-mile radius where women can receive prenatal care. But that's only if they can get to their appointments with midwife Linda Randolph, who comes just twice a week.
You know, some days we can have 12 scheduled and only have 6 show up, and other days we can have 12 scheduled and have 15 show up. Sometimes it can be frustrating. It's important to get prenatal care because there are so many things that can go wrong, and the only way for us to know that there's a problem is to have routine care.
The rate at which rural women die of pregnancy-related complications is 64% higher than in large cities. And Georgia has one of the highest maternal mortality rates in the country. 1/3 of the counties have no OB units at all. In Louisville, Linda Randolph can do basic prenatal checkups, but women must travel an hour to Augusta for anything that requires specialized equipment, such as diagnostic imaging, and to deliver. Without a car, being pregnant can be a logistical nightmare.
Transportation is our biggest issue, and it's kind of a 50-50. Some have cars, most don't. A lot of them carpool. I have several that walk. Some of them take Medicaid transportation. Part of the problem is it's such a large area that they're coming from outskirts and they're having to come from a distance. Some of them drive 45 minutes just to get here. Now, I know you're having trouble getting to Augusta to get that ultrasound and all. Is there anybody that you know of that can take you?
I could probably ask around, but it's gonna be hard. Just give me about 2 weeks.
2 weeks.
A rural area like this, you gotta get there how you get there.
In rural Georgia, a lot of the ladies don't get care outside of pregnancy. So there are other coexisting issues that a lot of them have. We see a lot of heart disease, a lot of diabetes, a lot of high blood pressure. And if those are left untreated, then ultimately mom could die. If something goes wrong with your pregnancy or with your delivery, you can have a matter of minutes. I mean, minutes. And if you are an hour away from a hospital, as opposed to 5 minutes away from a hospital, that makes a big difference.
The number of rural labor and delivery services has dropped nationally by 15% from 2004 to 2014. In Georgia alone, 35 OB units have closed in the last 2 decades, 1/3 of those in just the last 5 years. That's partly due to a declining rural population and a poor economy. As people get sicker and medical costs increase, hospitals aren't able to sustain themselves.
Some of the largest difficulties, number one is reimbursement. Not all of our patients have insurance. Many of them are self-pay, and if they don't have money, it's very difficult to collect money from them. Another one is access to qualified personnel. So being in a rural community, not everybody wants to live in rural Georgia. It's hard for us to pay competitively with, say, Augusta. You really have to have a passion for rural health care.
A lot of people are straying away from the rural areas, and I understand that. It's not for everybody, but there are ladies that live out here that need care. They need somebody that wants to do it, is not just doing it for a job. And if I can be that one person that steps in their life and says, you are somebody, that's worth any money that I could ever be paid.
All right, just go.